Hello, everybody. Checking in, checking in, checking in. Let's see, the lighting is good. Are we good? Are we good? Good stuff. All right. All right. Almost ready. So, just about ready to start sipping tea. Okay. So, good evening, everybody. I want to say thank you for tuning in and welcome. Waiting for everybody to come on in and get started. I know. Hi, Dee. Okay. So, everybody, good evening. It's 7:30. And I just wanted to welcome everybody into Tea Talk Tuesday. I did a live last night, and I mentioned that, first of all, let me introduce myself. My apologies. My name is Dr. Kitty Adley, physical therapist, lymphedema therapist, and owner of Handling Your Health, Wellness, and Rehab in Nassau, Bahamas. I own a small private practice which caters to orthopedics and oncology, specifically breast cancer, but we treat all cancers. We're helping people who've been diagnosed with cancer to live their best life, to limit their side effects, and to make sure they return to normal as challenge-free as possible. And I have been a physical therapist for 18 years, but I've been dealing with oncology patients for the last 14 years. I became a certified lymphedema therapist in 2004. And as a result of treating patients, cancer patients for lymphedema, I sort of had to grow and expand my offering, because I was finding that the women predominantly I saw for breast cancer also seemed to have other complications, like challenges with the scar, tightness, pain, restriction. They had range of motion challenges at the shoulder. There was numbness, there was tingling as a result of chemotherapy. There was hardening and stiffness as a result of radiation therapy, and just a lot of other complications that were manifesting. And so by default, I had to understand the presentation of these conditions, what caused it, how to limit it, and how to reverse it in many cases as much as possible to make it to make the situation more comfortable for the breast cancer patient. I have been asked many times to give talks and presentations on wellness for breast cancer. I pride myself in this. I love to share information, and I think you need to make the information available at all times. I found in my practice, there are people that don't know that there are resources available for them as they go through breast cancer rehab or any cancer rehab, and they struggle in silence and they struggle alone. And so I really tried to make it my mandate to share it. So about 4 years ago, I started something called Tea Talk Tuesdays at my clinic. And what it was that on the third Tuesday of every month, we would have something that's called Tea Talk. And it was just a casual outing where you come out and we would share information with you. And we would get wellness experts across the board, not just me talking all the time, but we would get nutritionists, pharmacists. We had people talk about life coaching, spirituality, finances after illnesses. And we just found that the cancer survivors, their families and friends enjoyed it so much. And it was really good and it was really consistent. But since we moved to our new location, we have not started it again. And I wanted to do it, and there was always one reason after the other. And I sat down and I thought, well, I can't physically do it, or I haven't been able to physically do it in my space, but I can probably come online and do it. I've been posting messages about breast cancer awareness, breast cancer rehab, and I've got a lot of questions. And I realized that there's definitely a need for more sharing of information. So I decided that I was going to take Tea Time Tuesday to Facebook Live. So I'm here sipping my tea. I'm drinking lemongrass, or fever grass as we call it in the Caribbean. I probably need a good cup of Cersei because I'm fighting a little cold. I don't know what it is, but right now I can only get some good lemongrass. So I hope that you have a nice warm cup of tea and you sip whilst we chat and I try and answer the questions that you have. So I'd like you to post your questions or any comments that you have in the box. I'm going to try and follow it as much as I can. Ding me and let me know, and we'll start from there. So one of the first questions I had was, what was axillary nodes in a breast cancer patient? And so I wanted to start with that because, like I said, my introduction to breast cancer rehab came through me seeing patients in the hospital with this swelling, breast cancer patients with this swelling that didn't seem to be, I couldn't resolve by the methods that I was taught in physio school. And as a young grad, you felt that you wanted to treat everything and manage everything appropriately. And I was not getting the results that I wanted from this. So I did some research. At the time, none of the medical professionals I worked with, unfortunately, had an idea of what it was. And so I did some research and realized that this presentation was called lymphedema. So as soon as a course became available, I went off to the Academy of Lymphatic Studies, and I did my 2-week certification in lymphedema management. And so I was better able to help these people by helping them to reduce the edema and then putting them into compression garments that were going to regulate the swelling. So to answer your question, what are axillary nodes? Axillary nodes are nodes that belong to the lymphatic system. And your lymphatic system is like the sewer system of the body. It is responsible for moving waste matter and foreign objects, small foreign objects from the body. So as your blood circulates, your blood goes down into your arteries, it washes your tissue, it leaves through your veins. Not all of it leaves as blood. Some of it stays as lymphatic fluid, and it cleans the body. It picks up pathogens, germs, disease-causing bodies, foreign bodies, and what it does is it picks up in its own system called the lymphatic system, and it moves it back into the center of the body towards the heart, where it can be cleaned and then recirculated again as blood or whatever product that get rid of the waste byproduct. So we have at different points in your body, you have what we call grouping of nodes. And so one of the areas is your axilla region. And why you hear so much about that with breast cancer patients is because that's the grouping of lymph nodes that are closest to the breast. So usually when a woman is diagnosed with breast cancer, you hear the term biopsy. Well, we have to do a biopsy of the growth or the tumor, and we need to check and biopsy the lymph nodes nearest to the area. And that is done to see how far the cancer cells have progressed from the site that it originated. So remember now, I said the lymphatic system picks up foreign bodies. Cancer cells are considered foreign bodies to a certain extent. And the lymph nodes, the lymph system would carry that to other parts of the body. And so when you're diagnosed with cancer, we want to see how far the disease has progressed from the original site. And so axillary nodes are usually the nodes that are excised, removed, and tested to see how far the disease has progressed. When you remove lymph nodes, you decrease the ability of the body to remove the lymphatic fluid from the area that it's being serviced. And this is how you have the presentation of lymphedema or swelling. And so you have to try and keep that area moving. You have to keep the lymphatic system as stimulated as possible, because what you've in a sense is remove some of the pumps that were moving the fluid out of the area, right? So like I said, the blood goes down into the arm, does what it has to do. Some of it remains a little bit as lymphatic fluid. We pull it back up through the lymphatic fluid, through the lymphatic system. But because some of the lymph nodes have been removed through surgery, or they can also be compromised through radiation. And when we say compromise with radiation, that can cause burning, and it causes the lymph nodes to wither up and they don't function even though they're there. And so that can also cause lymphedema. And so this is why you always hear about axillary nodes, and you see the presentation of lymphedema in the arm. Usually that's closest to this breast that was affected with breast cancer. So I hope that answered your question. If I need to go over it with a little bit more to give you more clarity, please let me know. I'm going to take a sip of my tea. So, if anybody's sipping tea or drinking, just let me know what you're drinking, what herbal tea you're drinking, because, you know, we want to make this as informal and comfortable as possible. So, like I said, I have fever grass in my cup. Hopefully it keeps me calm so I can disseminate the information to you. So, my second question I got was from a young lady who wanted to know what were the signs of breast cancer if she was breastfeeding. And I have to say that the signs are basically the same if you weren't breastfeeding. So what we're looking for is we're looking for changes in the skin of the breast. Any rashes, any darkening, any wrinkling, any indentations, any extra growth. We're looking for changes in the nipple. Now, you're breastfeeding, and the nipples may change. They may get a little sore depending on what part of the breastfeeding aspect you're at. Usually some women get very tender around the first time as the baby is learning to latch onto the breast. But if you see any changes, I bet drinking lemongrass too, great. If you see any changes on the breast itself, you need to report it immediately to your doctor, right? You don't take anything for granted. It's better to be safe than sorry. If they think you're being extra, well, that's fine, but you want to make sure that you do that. If your breast is discharging anything else but milk, then we need to get that. If the breast is changing shape, if it's changing color, if it's changing texture, you definitely want to get that checked. Okay? So the other question that we had was, can I get back to running after I've had breast cancer without causing lymphedema? And that's from my good friend Cozy. And Cozy, yes, you can. You want to make sure that you take precautions. So know what your baselines are. Follow your breast cancer. Follow the measurements of your arm. So what we do in lymphedema management is we measure your arm. We take a baseline measurement. We try to do this actually before you have surgery or before you have any cancer interventions, because we want to know what your arm size was before you started treatment. That would give us an idea of if there are any significant changes in your arm, if lymphedema is starting or not. So we take baseline measures. We measure different levels. So you want to have the measurements done on the arm, and your therapist would hold those measurements. Also, it's usually a compression sleeve is given if you show any signs of swelling. And so as you exercise, we recommend that you keep your compression sleeve on as much as possible, especially if it's hot, if you're doing any vigorous activity, and running can be considered vigorous activity. What I have noted with some of my patients that do run, though, we have to make a special effort not to keep the elbows flexed, because if we have compromised circulation in the lymphatic system, keeping the elbows flexed is going to impede your flow, stop your flow. So make sure, try and extend your elbows, straighten out your elbows as you run. Just don't keep them tight and run, because that can also cause swelling or the feeling of fullness in your arm. There's a fantastic group called Lymph Strong, I think it's called. Let me see if I could find it here for us. And what I really like about them, I mean, these are women and men with lymphedema that have not allowed the disease to stop them. So, Cozy, I think this is a great group for you to follow, because it'll definitely give you resources and people that are actually doing it with lymphedema. I mean, who better to tell you that than people that are in the race themselves, right? So you adhere to all your precautions of lymphedema, risk prevention. And let me just mention what those are. You want to stay away from extreme temperatures, particularly heat, because we know heat can cause swelling. You want to make sure that you protect the arm from the sun. You don't want any sunburns. So try and use this natural sunburn or keep the arm covered. The sleeve definitely will help. You also want to avoid any nicks or bruises on the arm because that can cause an issue. We're going to address that a little later. Avoid tight constricted clothing. So a lot of people say, but you don't want me to wear a tight sleeve, but you want me to wear a tight sleeve, but you're telling me not to wear tight clothing. So the difference between tight clothing and a tight sleeve is the fact that when we give compression sleeves, they are measured for your arm, for your particular size, and they also have what we call compression, graded compression or graduated compression, meaning that the compression is tighter towards the wrist and it lessens in compression towards as you get towards the top of the arm, and that's to ensure that we have a balance of pressure. We need more pressure at the bottom to make sure we can get that fluid to push back up into your arm. So that is different than having a sleeve. You can see my arm that's constricting you like that. It's actually producing a tourniquet effect. We don't want that. And we definitely don't want you to wear tight rings or tight watches that are going to constrict that. That can be another trigger for lymphedema. We like to say avoid pinpricks and insect bites on the arm. I think I had mentioned that before. There is a rule that you don't lift heavy on the arm, but I know some kick butt girls that are doing some CrossFit and some gym training and they're lifting weights. My only caution with that is you want to make sure that you take your time and you build up your ability to lift. You just don't want to start out the back bench pressing and deadlifting weights that you have not trained for, because that can trigger a response and cause some swelling. So there's no reason why you shouldn't be able to exercise and do whatever you want once you take into consideration the precautions of lymphedema. So, hi, I see Miss Ann is watching. Hello, Miss Ann. So, like I said, as you watch, please feel free to drop your questions in here and let me know anything that you may want to have answered. I am looking up that group right now for those of us that want to exercise with lymphedema. They're a fantastic group. I've been following them for a few months. I mean, these people exercise like nobody's business, and they're doing marathons and they're doing great, fantastic feats of exercise. Okay, so I'm going to post it right now. Right here, Lymph Strong, and so you can visit their Facebook page. Like I said, I think they're an awesome group. And did that come? I don't know if that was supposed to be like that. Let's see what that is. Let me make sure I give you the right information. Nope, that was not it. I just sent you another post for for the event that you're already at. All right, so like I said, please put your questions in there and we will go ahead and answer them. So while that is looking up, let's talk about this. So I met a wonderful lady on Saturday, and she had a sleeve on, and she didn't quite have the sleeve on the way that she was supposed to wear it. And sometimes I have to remember that I'm not at work all the time, but I can't see things that don't address it. So I was like, well, I noticed that you have your sleeve on. And she was like, yep, I have a sleeve. You know, I've been fine. I've had breast cancer 20 years ago, and I've never had a problem. And all of a sudden, I ended up with this thing called cellulitis. And I don't know what happened. My arm just got swollen. And so she didn't know what had caused it. And I guess to her to talk to her about it. She was pretty frustrated about it because this is somebody who had been a breast cancer for 20 years with no complications of lymphedema, which is fantastic. But it brings up a point that lymphedema can occur at any stage. It can happen right after surgery, or it can happen 20 years after, in the case of this lady. So what she had was cellulitis. Somehow she got a nick or a cut, very minute, and what it was is this mild infection. Even though she may have not seen a lot of swelling, like I mentioned before, when you remove lymph nodes and you have radiation, your lymphedema transport capacity decreases. So your circulation is not the best. And these arms, these areas are prone for infection. So you would see a little bit of swelling in the area, you get redness in the area, and then it gets very, very painful. What can also happen is that it causes sweating and fevers in the person because it becomes mainstream. And if it's not caught, it can make somebody very, very sick and can probably even lead to sepsis if we leave it unchecked. But what happens is because it's an inflammatory response, the body automatically recognizes that and it sends more lymphatic fluid to the area, it has a reaction. And so if you send more fluid to a system that's already compromised, what's going to happen is that it's going to become overwhelmed. And sometimes it will not reduce like a normal body part. And I think this is what she is actually experiencing. And so what we have to do now is we need to bring her in for some sessions. And what the sessions will comprise of, first of all, is education. And let her know it's not really her fault that it happened that way. That we can help control what's happening and reverse what's happening. So we use manual lymphatic drainage, which is a manual technique. Some people say massage, but it's specific strokes. Hi, Cozy. Hi, Sherelle. It's specific strokes to try and redirect the lymphatic fluid, but also stimulate the lymphatic system that's there to help with the uptake of the fluid. And so we do that, and then we also apply compression to the area. And usually it's not just a compression sleeve like she had on. We will actually have to apply some bandages or an alternative compression wrap to the area to try and decompress the swelling in the arm. And usually within 4 to 7, sometimes it may take 10 to 12 sessions, but usually in a case like that, because we caught it early, you can get great reduction. You reduce the arm, and then we remeasure her and put her into a sleeve that's going to give her the adequate compression. So that's one of the risk factors for lymphedema. I mean, anybody can get cellulitis, but just because the circulation is compromised in that arm, you are more prone for lymphedema. So Cozy, I'm trying to find the Facebook group that does the running and the sports that you're interested in doing. So I'm trying to bring them up. Give me just a sec. And let's see. I think I found them. Oops, come on. One half a second. Oh, come on. All right, so let me just put it in the chat. There should be a way for me to share the link. It doesn't want to share for some reason. It's not copying. But does anybody have any questions so far about anything I said? Is there anything I need to go over in terms of that? This is my first time, so I'm a little nervous. I just want to share that with you. And yeah. So here we go. Tamika, I sent you the link, so hopefully you should be on. And let's paste that there. Please come. Oops. Did we get it? Did you get it? All right, so Cozy, I can't seem to get it right now, but I will definitely post it in the group. Hi, Tamika, I'm glad you got on. I'll definitely post it in the group for you later because I think this is the group that you need to stick with. If you want to exercise like you say you want to do, and I know you're awesome with it. Great. All right, here we go. There we go. It's in. Now let's hit enter, and hopefully it should pop up. Does it? There we go. So that's the Lymphy Strong Inspiration Group. Sherelle, don't worry about it. I will definitely share it on the page so you can always go back to it and share it to anybody else who may benefit from the information. So I'm thinking I'll probably do this every Tuesday for half an hour just to share some information. It's amazing that people ask me, so why does a breast cancer patient need physical therapy? And then I have to explain to them, I said, you know, if you have surgery, you can't move certain parts. And so imagine having your breast removed. You're getting cut across your chest. And you don't think about it, but every time you move your arm, those muscles pull. So that can definitely affect the upper extremity function, the arm function of somebody. So that means a woman who's lost her breast and has that long mastectomy scar may have difficulty putting her hair up, right? Putting on her glasses, answering her phone, bathing herself. And then usually there can be pain and there can be stiffness in the area. Hi, Melissa. And the scar tissue can be very tight. And that's just from the surgery alone. That's not taking into consideration the chemotherapy and the side effects of chemotherapy, which consist of the nausea, difficulty having bowel movements, right? Because it affects the nerves. There's peripheral neuropathy where there's numbness and tingling in the arms and in the legs, the hands and the fingers. They can also have pain in the joints, and then radiation comes along with radiation burns and what we call radiation fibrosis, like I mentioned earlier, where the skin, the tissue, the joints get very tight and very rigid. So these women need help, helping them to mobilize their arm and their shoulder. Hi, Nat. And they also need help with scar tissue. They need help with strengthening. And then there are a lot of invisible things that we don't see. So I had a patient, I actually have two patients in here that are struggling right now. And struggling, it's not the best word. They've practically completed their cancer treatment. But what's happened is they've returned to work. They've been off of work for a few months going through the treatment. And their colleagues are looking at them like, well, you're fine. You had cancer. You're over it. You had your treatment. But these women are struggling with fatigue. And I don't think we talk often enough about the side effect of fatigue, which can happen as a result of chemotherapy as well as radiation. And this fatigue can last months and even years afterwards. So they're just tired, and it's just not a regular tired. It's a consistent chronic tired, no matter what they do and no matter what they take. And it's just because the effect that the chemotherapy drugs have had and the radiation has had on their system, it just makes them more fatigued. And I think we need to be more empathetic to breast cancer survivors, not because they look like they're bounced back, the hair is growing back, they're wearing makeup, they're looking pretty and they're cute, means that they're over the effect of the disease or the condition itself. And then a lot of these women are still taking medication long after they started their initial care. So just bear in mind that, cancer patients or cancer survivors struggle for some time and maybe long after. And we need to bear in mind that that's one of the things that they deal with. So this is why physical therapy or cancer rehab is so important, because we know what those anticipated side effects are. So what we try and do is we try and educate the cancer survivor of what they can expect, and not just the survivor, the co-survivors, because you have the husband that expects his wife to get up and cook dinner afterwards, or you expect the wife who has a husband, and I'm not talking about, well, men can get breast cancer too, but sometimes men have the same fatigue. He's not able to do his household chores anymore, and so we need to be sensitive to them, and we need to make the allocations or the modifications in the house. Excuse me, I'm going to sip some tea. And taking into consideration the fact that they're not up 100%. They're still fatigued. There may still be stiffness. There may still be numbness and tingling in the hands and feet. And so we really have to make sure that we are very aware and we're concerned. We show concern, and we're looking out for these things and telling them it's okay. You have to find your new normal. You have to be patient. Hi, Miss Mary. Thanks for coming on. I spoke about some stuff earlier. You may want to go back and just press play when I'm finished with this. So I promised to be on for half an hour. We have 2 minutes left. Like I said, thank you so much for joining me for tea time. I'm drinking my fever grass tea. So next week at 7:30, I plan to be back on. I ask if you've enjoyed this. Please let me know if there are other topics that you want me to cover in regards to breast cancer rehab or cancer rehab or lymphedema, whatever topics. Just send me a note, send me your questions, and I will try my best to answer them in our next Facebook Live, which should be next week, 7:30 at the same time. I thank you so much for giving me your time. I know your time is precious. I know it's valuable. Valuable. We've had a long day. And for you to sit down with me for half an hour and support me, supporting the breast cancer survivors, I truly, truly appreciate it. So thank you so much for your time again. Have a fantastic Tuesday. And as always, this is Dr. Kitty Adley, physical therapist, lymphedema therapist, breast cancer rehab specialist, mother, daughter, wife, signing off from Handling Your Health, Wellness, and Rehab in the Bahamas. Even though I'm in the Bahamas, please feel free to reach out to me via Facebook. Have a wonderful evening, everybody. Good night. Be safe. Be well.